Good afternoon, everybody. We are Healthy Liverpool Hearts, and this is a collaborative organisation. We come together across the whole of Liverpool, looking at how we can improve cardiology services, not just across the city, but across the whole of Cheshire and Merseyside as well. We have support from our whole health economy for this venture, and we've chosen the Liverpool area first because of our links with the Healthy Liverpool programme, which we'll talk about a bit more in a minute. I'd like to introduce my colleagues. I'm Debbie Herring, first of all, and I'm Director of Strategy at Liverpool Heart and Chest Specialist Hospital. I've got here Vish Sharma, who is a consultant cardiologist from Liverpool, the Royal Liverpool Hospital. We've got Dr. John Morris, who is a consultant cardiologist from Liverpool Heart and Chest, and then Dr. Seema Douglas, who is a consultant cardiologist from Aintree University Hospitals. We believe that our model, our aim is to create one single cardiology service across the whole of the city boundaries first of all, and that will focus on prevention, primary, secondary, tertiary and community services. And being provided by a single multidisciplinary team as well, not just focused on doctors and nurses, but other health professionals as well. And we do believe that we have a good record of collaboration so far, and that we want to use this to build on it. We've put on the tables some infographics here, so there are some of these on the tables, and there's also some posters at the back, which describes a patient journey now in Liverpool and what we think a patient-centred approach would look like when we succeed with our Vanguard application. Thank you.
Thank you, Debbie. I'm here to tell you a story, a patient story, and this story is a typical story of a patient living in Liverpool, and was developed based on actual patients' experience and journey through the 3 different organizations. I am Terry, and I'm 72 years old. I have lived in Liverpool all my life, and over years I've been many times to Aintree for different medical reasons, and they know my clinical history very well. I have diabetes and kidney problems, and every time I go to Aintree, they can quickly access my clinical records. On Wednesday night, while I was out shopping in town centre, I got chest pain, and an ambulance was called, and I told them that I should go to Aintree, as they know me very well, but they decided to take me to the Royal, as it was closer. At the Royal, they had no records of me, and I had to tell them all my clinical history. After some tests, I was told that I was having a minor heart attack, and they transferred me to the heart ward overnight. The next morning, I saw a heart specialist who confirmed that I had a heart attack, and he said that I needed an angiogram. The angiogram was scheduled for the next day, Friday, and I was told that I had 1 blocked artery, and I needed to stay and be transferred to the Heart and Chest Hospital for a stent. The procedure was explained to me, and it sounded like having another angiogram, but a slightly longer procedure. The plan was for me to be transferred on Monday morning. I was very anxious and frustrated at the weekend waiting for my transfer. Finally, I got transferred on Monday lunchtime to the Heart and Chest Hospital. Once arrived in the Heart and Chest Hospital, everything seemed to move very fast, and I was taken to the theatre. I had an angiogram and a stent within a couple of hours of arriving, and I was sent home the same night. The cardiac rehab was very good and efficient and close to my home. A couple of weeks later, I noticed some niggling pain in my chest, and concerned given my recent history of heart attack, I went to see my GP. My GP wasn't concerned about the pain, but he did an ECG. He then told me that my ECG was very abnormal and that I needed to be sent to a hospital to get checked out by a specialist. An ambulance took me to Aintree this time, although I told them that I should go to Liverpool Heart and Chest Hospital, as I had just been there. The ambulances told me that they couldn't take me there, as the Heart and Chest Hospital did not have an A&E department, and I needed to stop in A&E first. When we got to Aintree, I was surprised that there was no record of my heart attack and recent stent in my clinical records at Aintree. They told me that the traces of my heart were abnormal and possibly I was having a heart attack, but they needed to get all my clinical records from the Royal and Heart and Chest Hospital. But because it was out of hours, they had to wait until the next morning to get the information. Therefore, I was transferred to the cardiac ward overnight, and I saw a heart specialist the next morning who told that the traces of my heart may be related to my previous heart attack, but he would like to get the other ECGs from the Royal and Liverpool Heart and Chest for comparison. He told me that once the ECGs are received, and if they are exactly the same, then I could go home. I waited for hours until I finally was told that I could go home, that there were no new ECG changes. 4 weeks later, within a week of each other, I got letters from the Royal and Aintree inviting me to attend the heart clinic following my recent hospital admission. I was very confused as I did not know which clinic to attend. When I contacted the Royal, they did not know I had another admission to Aintree. In the end, I decided I attend the clinic at Aintree because it was closer to my home. Thank you.
So how did we end up with such a fragmented system? Well, like many places, most of our decisions have been made as individual organisations, and often we've competed rather than collaborated. But things have really changed in Liverpool now. We're working together much more closely, and through the Healthy Liverpool programme, which is a transformation project led by the Liverpool Clinical Commissioning Group, we've really started to move things forward. This project is different to lots of other places in the country. It's got universal clinical buy-in, it's been clinically led, and most importantly developed in consultation with patients. And they've signed up to our key principles of improving care. Our aim is to deliver a single service model that will basically provide care across an entire city. This will allow patients to access the same high quality service no matter where they live in Liverpool. The care will be delivered close to home whenever possible, but centrally when necessary to achieve best patient outcomes. The advantage of this is that we'll be able to provide a truly world-class service for all our patients. As a vanguard, we can actually do this much more quickly. We've got systems in place already to build upon, and we can deliver services very quickly at pace so that people across the country can benefit from our progress.
Thank you. So I would like our ideal patient story to foresee a system in which, regardless of the point of initial contact, the patient is assessed and treated rapidly, efficiently, and according to the relevant local and international guidelines, with care delivered in the location most appropriate to the patient's needs. Patient's data would be available to the healthcare professionals who have a legitimate care relationship with the patient, wherever those data were gathered, and wherever the patient ends up. As Vish has said, this work has already started, and our application to the acute care collaboration is for assistance in developing the organisational arrangements to allow the commissioning of a single service delivered by three distinct organisations, and to enable the IT infrastructure and governance to deliver secure data transfer between those organisations, and importantly, the need to develop the financial arrangements that avoid unduly disadvantaging any of the partners. We believe this model, once developed, can be adapted to other clinical services in other areas of the country where the current competitive commissioning arrangements produce unintended obstacles to the best patient care. Thank you.
Thank you very much. So questions for Healthy Liverpool Heart? Question there, and then we'll go to you next.
Hello there. Yeah, my name's Gilbert Wheeler. I'm a patient representative and also work with various bodies. One interesting part about heart attacks and heart failures and things like that. Information. What information do you give the patient going home with after they've had a heart attack, or in specifically, this case, cardiomyopathies? What do you give them information-wise to go home with?
So at the moment, all our patients get a discharge letter and they get a copy of their ECG. The problem is people file these away and they never bring it with them when they actually come to hospital. So what we're hoping is that basically people will be able to, doctors can access this centrally across the system. So we're in the final stages with a joint EPR project, an electronic patient record project for the entire city, which will hopefully come online in the next 12 to 18 months. And then as part of the the Healthy Liverpool programme, there's a digital innovation arm where hopefully we'll give access to patients to their own records, so they can actually be able to access their own ECGs, their own records, whenever they pitch up to hospital.
Sam,
If I could add to that, specifically about patient information, patient education, that all of our patients also start the cardiac rehabilitation process in hospital. They're seen by a cardiac rehabilitation nurse who will give them the advice they need about how to behave, and what to expect when they go home. They're contacted by the cardiac rehabilitation services within a couple of weeks of discharge, and we aim to start the cardiac rehabilitation programme within those 2 weeks.
And so just one final thing, and we hope, under the new system, for each patient to have their own care manager that they can sort of access, whenever they have any further problems.
Okay, Sam has a question.
One of the things that stood out from the story we just heard was how we have got to deal with the fragmentation, very ably articulated. So one of the challenges we have is around not accepting variation. And how will you, through your vanguard, address this, both locally and also nationally? And I really want to try and, if you can, get behind the standard response of working with people to get them on side. And I say that very politely because that's incredibly difficult to do.
We've already developed clinical pathways upon which we all agree, and the governance arrangements with our own hospitals will enforce the delivery of those standards.
Okay, I just need to take a quick question over there. It's been waiting.
Good afternoon, Trevor Clough from a patient's rep from Nottingham. I actually like the way you've actually grasped the patient's story. Every patient's got a story. Sometimes it's very hard to listen to, but the way you've grasped it and moved it forward, because it uncovers so many different areas, and it's a patient's voice that does move professionals. I've seen that happen so many times in and around the country, and I do like this presentation.
Thank you. I mean, absolutely. We listen to the patients, and as a clinicians, we actually is very much driven by us clinicians, by listening to the patients and trying to provide the best care for every single patient, no matter where they pitched up.
Okay, can I have a question now from St David and then from table 4, the lady on table 4?
So I'm trying to get all my questions in because I'm not here tomorrow, unfortunately. So last one from me. Just to pick up on Sam's theme there about variation and reliability. Care pathway stretching into primary care, is that where you're going as well? If 2/3, 3/4 of care is provided by primary care practitioners, how are you getting them involved within your proposals?
Well, we already provide community care from Liverpool Heart and Chest, and we've just put in an application for a bid and been successful to provide, this is a collaborative bid across Aintree, Liverpool, ourselves, and also Wiston Hospitals, which is a whole community service. And so we're already out there in the community, and we're looking at here one cardiac pathway that goes across, one cardiology pathway that goes right the way from prevention, right through, as I say, to rehab at the end. We have got some experience of doing that, and we're building on that now with this new bid. We've had 2 clinical summits involving cardiologists from across the city, from all of these different organisations, and they have signed up and agreed to one single pathway, and it's now just putting the flesh on the bones of that. So I think the difference is there are pathways out there. We all know there are pathways, but as we know, people do not follow them, or there's variation. But in this case, it has been clinically led, and I think we have got some proof of concept already. Thank you.
Thank you. The question here.
Hi, it's Sarah Morgan from Guy's and St Thomas's. I really like your presentation. I think one of the things that I was thinking about, and you touched on this a bit, is around that many patients have comorbidities, and I think your patient that you talked about had a comorbidity, but wasn't quite clear about how those comorbidities would be linked into this pathway. And so you may have fabulous heart and cardiac service, but what about diabetes, etc.? So if you could elaborate, that would be helpful.
I think the model, obviously we presented the model in cardiology, but we believe that this model can be replicated in all chronic conditions, and it's just not to cardiology. Any other chronic condition can have the same sort of pathways, unique pathway with the access to the specialist care and equal access to all the patients within Liverpool.
And just to add to that as well, so it was the cardiologist that sort of came up with this strap line, if you like, of single service with citywide delivery. But because of the benefits of this service and the scalability, that's been adopted by the whole of the Healthy Liverpool programme. So actually all the services are going to be following a similar model within Liverpool. So diabetes, renal, etc. are all signed up to the single service model where they basically will provide the same level of care no matter where you are in the city.
Thank you. We need to leave it there. Thank you very much. That's Healthy Liverpool Heart.